Worldwide, billions of people suffer from heart disease. Heart disease and its components include high blood pressure and high blood sugar results in the largest number of deaths in the world.
China is transforming one of the world's largest healthcare systems. With over 1.4 billion people, the country faces major healthcare challenges, rising medical costs, aging citizens, and unequal rural healthcare access. Now, China is accelerating healthcare reforms focused on affordability, stronger medical infrastructure, and wider healthcare coverage. The government is investing heavily in AI-powered diagnostics, telemedicine, and smart healthcare systems. Electronic medical records are also becoming more common nationwide. These reforms could mean shorter waiting times, lower treatment costs, and better healthcare access for millions of people. Experts believe China's healthcare transformation could influence the future of global healthcare itself. A deadly hantavirus outbreak aboard the MV Hondius cruise ship has sparked a major international emergency response. The ship anchored near Tenerife in Spain's Canary Islands after several passengers fell ill during the voyage. 17 American passengers have now been evacuated and flown back to the United States, where they will undergo mandatory quarantine in Nebraska for up to 8 weeks. More than 100 passengers from Europe and Canada were also repatriated under strict health and safety protocols. Passengers on board followed strict hygiene rules, including masks and social distancing, as fear spread across the ship. Health workers used specialized protective equipment and negative pressure medical pods during evacuation flights. The World Health Organization has reassured the public that hantavirus is not another COVID-style pandemic. The WHO says the overall public risk remains low. However, concerns increased after one passenger reportedly tested positive during a flight back to France.
A major shift is happening in Indian healthcare as Chinese biotech firms and domestic pharmaceutical companies form strategic partnerships. These alliances are bringing next-generation immunotherapy to India, specifically targeting lung, esophageal, and nasopharyngeal cancers. The impact is massive. While Western immunotherapy drugs typically cost between 2 and 5 lakh rupees per session, these Chinese origin alternatives are priced near 50,000 rupees, drastically slashing medical expenses for families. Indian oncologists are already reporting strong clinical patient responses, easing initial apprehensions regarding quality and suitability. This marks a new era where life-saving cancer treatment is finally becoming accessible to all.
India is experiencing a critical longevity paradox. As life expectancy rises, we are seeing a dramatic surge in lifestyle diseases. A national health survey revealed that nearly half of our population now suffers from cardiovascular and metabolic conditions like diabetes and hypertension. This marks a staggering increase from just 31% recorded a decade ago, showing how quickly our health landscape is shifting. While medical science has suppressed infectious illnesses, sedentary routines and poor dietary habits are expanding the national disease burden. This disturbing shift is disproportionately striking adults over the age of 45, making awareness and prevention more critical than ever. It's time to address the silent crisis behind our rising longevity. Let's prioritize health over habits.